over recent years, we have published a number of papers which concern these biomarkers in Parkinson's disease and for developing so-called preclinical diagnosis, long before the clinical diagnosis by motor symptoms. Well, so in the first paper, we declared that despite this methodology would be always non-specific, we could improve it a little bit by searching biomarkers not only in patients at the early clinical stage, in non-treated patients at the clinical stage, but also in animals when modeling preclinical stage, early development of Parkinson's disease, okay? Well, that was the first paper. The next paper was that we told people that we could use to search for biomarkers, not only cerebrospinal fluid in the blood, as it is widely used, but also a tear fluid. Well, so, and we have shown that there is a number of rather specific, all of them are non-specific, but there are rather specific biomarkers in the tear fluids, and it takes nothing to use these biomarkers for patients and for physicians. Well, so it is very easy to take this specimen. Well, and finally, this year, we have published a paper with the biomarkers in the blood in patients at the preclinical stage, at the so-called prodromal stage, when the motor symptoms are not evident, but still there are several premotor symptoms which appear as RBD, as hyposmia, etc. And we've found at least a dozen or even more of biomarkers in the blood. Well, so we continue to do it, but I emphasize again that I do not believe that the search for biomarkers will give us an opportunity to develop preclinical diagnosis with certainty.